Carrie. I'm Alex. I'm going to do a neuro exam on you today. So it's just going to be kind of a little lengthy process just to make sure everything is working right. So your eyes open spontaneous whenever I entered the room and talked to her. So she's going to get a 4 on the GCS for that. Can you tell me your name?
Carrie Smith.
What about your date of birth?
9/3/85.
Okay. Do you know what season it is?
Feels like winter, but it's fall.
Okay. And who is the current president?
I don't know. No, it's Trump.
Trump, okay. So she's gonna get a 5 on the verbal response because she's oriented. Now we're gonna do assessing her motor response. Can you squeeze my fingers? Thank you, good. Can you push against my hands? All right, and pull back? Okay, good. So for her motor response, she's gonna get a 6 because she obeys commands. Her posture and position, she has appropriate posture and is in an upright position. Everything appears symmetrical looking at her. Her general appearance has no obvious deformities or abnormalities. Facial features appear symmetrical. Her posture is erect and the patient is sitting upright. Are you having any pain right now?
No.
Okay. So on a scale of 1 to 10, you would rate it at a 0, okay. And so since she's not having pain, we know that nothing makes it better or worse, and there's no pain to describe. I've assessed her vital signs. They all appear within normal limits. Now I'm going to assess cranial nerve 2 for visual deficits. Okay, can you cover your right eye for me and read this chart?
FELOPZD.
All right, very good. And now cover your left eye and read it again.
FELOPDZ.
Close. All right, so there are no visual deficits noted. She can read the lower line of 7. I'm going to assess her hearing deficits. I'm going to include one ear at a time and whisper a 2-syllable phrase, and you'll repeat the phrase.
Baseball.
Okay.
Apple.
All right. So no hearing deficits noted. Cranial nerve 8 is intact. Now we're going to assess her recent and remote memory. Can you tell me what you had for breakfast?
Blueberry bagel.
All right. And now can you tell me who your kindergarten teacher was?
Mrs. Wilcoxon.
All right, good. So no memory deficits are noted. Speech pattern or difficulties. Can you repeat this sentence for me? It is almost time for Thanksgiving break.
It is almost time for Thanksgiving break.
All right, very good. Speech is clear with no abnormalities noted. Eyes and pupil assessment. So I'm going to assess your pupillary reaction. I'm going to, oh, this is a weird pen light, okay. Okay. All right, very good. Also with this, I'm gonna have you look ahead, just straight ahead at the wall for me. And I'm gonna have you focus on the wall and then come back to my finger without moving your head. All right, and back to my finger? Okay, very good. So, we have done pupil response, accommodations. So her pupils were equal, round, and reactive to light, and accommodations. And now I'm going to assess the 6 cardinal fields of gaze. So follow my finger with your eyes and try not to move your head. Okay, very good. So for your motor function assessment, I'm going to assess that in cranial nerve 7. Please smile for me. Okay, frown. Okay, and puff out your cheeks. All right, very good. For the Romberg test, I'm going to have you stand up, put your arms out in front of you with your palms up, and close your eyes. Okay, so no swaying is noted, so she has a negative Romberg test. Now continue to stand, and I'm gonna have you walk just across the room here for me, and I'm gonna assess your gait. Okay, then go back. Okay, so her gait is even, her stance is balanced, and it's appropriate. You can go ahead and sit back down. Now I'm gonna check your muscle tone. So I'm gonna check your biceps and just kind of feel. And then we'll do this one. Triceps. Okay, now we'll do some passive range of motion, so just kind of lift your arm up and down, nope, okay, same thing, okay, good job. Now we're gonna do, we've already done your grips, we'll do it again, squeeze my hands, okay, good job. Presses, we done pedal presses at the beginning, they were equal and strong. So now we'll do the sensation portion. Let me get my Q-tip here. So basically I'm just gonna put my hands on your jaw, and I want you to tighten your jaw and then move it side to side. Okay, now move it side to side. There you go, okay, very good. Next we're gonna do the sensation portion too with the Q-tip. So I'm going to use both sides, and you just need to identify what side of the Q-tip I'm using, either the soft or the dull.
Soft.
Okay. Sharp. Okay.
Soft.
Sharp. Okay. Very good. No, geez. I have elicited the patient's gag reflex with a tongue depressor. It's all well and working. Now can you swallow for me? Okay, very good. Swallow reflex is present. Now I'm going to assess the deep tendon reflexes. Okay, this one, let's just hang your arm out here. Okay, ready? All right. Now we'll do this side. Okay, now we'll just go ahead and do this one. Okay. So hard to find the spot. There we go. Now bend it. There you go. Okay. Now I'm gonna do your patellar. We'll find it. Okay. All right. And now your Achilles. I'm trying to figure it out. Okay. Can you take your shoe off for me so I can assess your Babinski? Thank you. Yeah, that's fine. No, you're fine. Okay, so I'm gonna assess her Babinski. I'm gonna draw a line from the heel up to the ball of the foot and then medial across the ball. Okay. We'll do this one. Cool. So she has good reflexes, they're noted and appropriate, and her Babinski is negative, which is an appropriate finding for an adult her age. Sorry, I'm about to sneeze. So I think that concludes our neurological assessment. Thank you.